COVID vaccine, take one. Hey everyone, Dr. T here. Welcome to Focus Kids. This is a very special episode about a very important topic, the COVID-19 vaccine. Stay tuned, it's coming up right after the intro.
Cue the intro.
Hi everyone, I'm Dr. Richard Allen Turner. I'm a board-certified pediatrician. Welcome to my channel, Kids Info Network Dayton. I hope you enjoy the show. Focus Kids is coming right up. Welcome to this special presentation of Focus Kids. Today we discuss the coronavirus vaccine, so let's get into it right now. COVID-19 has resulted in over 300,000 U.S. deaths and countless illnesses and infections. In addition to that, it's caused great financial stress to those who have lost jobs or have been laid off all over our great nation. Anxiety, depression, and general mental health problems have skyrocketed since the pandemic. Kids have been thrown into chaos with school in, school out, and online school. Their daily routines and structure have been disrupted, if not completely shattered. The lack of routine, consistency, and structure is particularly disruptive and emotionally stressful in children. Indeed, we've all been thrown into chaos, and many of us are struggling. That said, there appears to be a light at the end of the tunnel. That light is the COVID-19 vaccine. Right now, there are two vaccines that have been approved by the FDA for emergency use authorization. The first is the Pfizer vaccine. The most recent, which received EUA approval from the FDA last week, is the Moderna vaccine. The Pfizer vaccine can be given to those 16 years of age and older. The Moderna vaccine is indicated in adults only 18 years of age and older. Before we talk about the specifics of how these vaccines work, let's talk about the benefits of vaccination. Getting vaccinated will help protect you from COVID-19 by creating an antibody response in your body without you having to get infected or sick with COVID-19. Getting vaccinated can prevent you from getting COVID-19 at all. Or if you get COVID-19, the vaccine can prevent you from getting seriously ill or dying from COVID-19. It can also help keep you from developing serious complications. Getting vaccinated can also help protect people around you from getting COVID, especially people who are at increased risk of severe COVID disease. Now let's talk about the vaccine itself. The Pfizer and Moderna vaccines are really very similar. There are a couple of minor differences though. The Moderna vaccine may cause a slightly worse local reaction, in other words, a little more redness and a little more swelling at the injection site. Both vaccines are given in 2 doses. The Pfizer vaccine is given 3 weeks apart, while the Moderna vaccine is given 4 weeks apart. Both of these vaccines are highly effective. Data has shown that the Pfizer vaccine is 95% effective 7 days after the second dose and actually starts becoming effective very shortly after the first dose is given. The Moderna vaccine is 94.1% effective after both doses are given. So how do these vaccines work? Both the Pfizer and the Moderna vaccines use messenger ribonucleic acid, or more commonly known as RNA. There are many types of RNA that are critical in using DNA to make proteins in all living organisms. The details of how RNA and DNA work and interact are really way beyond the scope of this discussion though. So why did they choose to use messenger RNA as a means for the vaccines? What are the advantages of a messenger RNA vaccine? Messenger RNA vaccines use non-infectious elements of a virus. They take less time to manufacture, they have the potential for targeting multiple diseases, they can be developed using a DNA template and readily available materials, and this is huge because it means the process can be standardized and scaled up, making the vaccine development faster than traditional methods. So how do the vaccines target the cells? Coronaviruses have a spike-like structure on their surface called S proteins. Both vaccines use messenger RNA to give instructions to the cells in your body to make a harmless piece of this S protein. After vaccination, your cells start to make the S protein pieces and then display them on the surface of cells. Your immune system will recognize that the protein isn't supposed to be there and then begins building an army of antibodies against them. Once your immune system builds this army of protective antibodies, if COVID-19 enters your body, the army recognizes the S protein and destroys the coronavirus before it can infect you and make you sick. Without vaccination, there is no army to protect you. Without this protection, you can get very sick, even die from COVID-19. Now, what are the common side effects of the COVID-19 vaccine? They're typically pretty mild and include pain, redness, and swelling at the injection site, fever, fatigue, headache, muscle aches and pains, chills, and joint pain. If you don't feel well for a couple of days after you get the vaccine, this does not mean you've gotten COVID-19 from the vaccine. Neither vaccine can cause COVID. What it actually means is the vaccine is working. As the vaccine starts to stimulate your body into making antibodies against coronavirus, as part of a normal immune system response, chemicals in your body called cytokines are released. These cytokines can cause fever, body aches, and just make you feel overall pretty crappy. But again, this just means that the vaccine is doing what it's supposed to do. The side effects typically last no more than 3 days and usually occur within a few days after getting the vaccine. Signs of an allergic reaction, such as hives, mouth or throat swelling, difficulty breathing, rapid heart rate, or dizziness, though rare, may be serious and potentially life-threatening. If you have any of these symptoms after getting the vaccine, seek immediate medical attention. Is there anyone who shouldn't get the vaccine? The COVID-19 vaccine may not be recommended for people with certain medical conditions or for those who have a history of serious allergic reactions. As always, talk to your healthcare provider if you have questions about whether or not you should get the COVID-19 vaccine. For the vast majority of people, though, the vaccine is safe and effective and should be recommended. Research will continue to shed more light on the protection that the COVID-19 vaccine offers. Some things that researchers want to look at are: how long does protection last? How long does it stay as robust as around 95%? Will additional booster doses be needed? And if so, will it need to be annual like the flu shot, or will 2 or 3 more doses be enough for long-term or lifelong protection like some vaccines, or every 10 years like the tetanus vaccine? What about vaccinating children? Pfizer is currently starting study trials for children 12 to 16, and at some point researchers will begin studies in younger children. In the meantime, the current vaccines appear to be very safe and very effective for ending the pain of this pandemic. I was really excited to get my vaccine. It was almost painless, and I'm looking forward to getting my second dose in 3 weeks. Does this mean that once you get the vaccine, you can stop taking precautions like not washing your hands, not social distancing, and especially not wearing face coverings in public? Absolutely not. Though the vaccine is highly effective, it's not 100% effective, so we still need to be careful. Once about 70 to 80% of Americans are vaccinated and we have sufficient herd immunity, then things can start to go back to normal, probably around the fall of 2021 by most estimates, and that's if the majority of people get vaccinated. Until then, the disease can still spread very quickly and continue to ravage our communities. I can't emphasize enough that point. Until we get to the point of good herd immunity, we all need to continue to heed the precautions prescribed by your state and local experts, including social distancing, face coverings in public, good hygiene and hand washing, and stay at home if you're sick. This has been a very special and massively important presentation of Focus Kids. From the entire staff of Focus Kids, Real 31 Productions, and Win-Lose Studios, thanks so much for watching. Don't forget to like, subscribe, and share, and hit that bell notification so you don't miss an episode. I'm Dr. T. Until the next one, I'll catch you on the flip side. We're out. Signing my life away here.
So I need your date of birth. Are you sick today?
No.
Have you ever had a reaction? MA? Severe allergic reactions that required an epi?
No.
Bleeding?
No.
Treatment? Okay. All right. You ready for this?
Yep.
All right. No, you don't. No, no, no. Put that back on.
We still have to wear these.
Yes, you do. Thank you. That's it.
Perfect.